Hello everyone. In today's class, we will discuss about ocular hypertension. Its definition, what is glaucoma suspect, what are the risk factors, the investigations to identify the treatment, and a small note, a brief note about ocular hypertension treatment study. So let's begin with what is ocular hypertension. So it is defined as a condition in which IOP is elevated above the cutoff value, that is 21. IOP is above 21 mm of Hg, but there are no visual field or optic nerve disc abnormalities, and there is open angles. So glaucoma is actually a triad of raised IOP, visual field defects and optic nerve abnormalities, right? But here we do not have any of these. Coming to who is a glaucoma suspect. So as we said, glaucoma is a triad of raised IOP, visual field defects, as well as optic disc changes, right? So if all these three are present, then only we call it as a glaucoma. So in this glaucoma suspect, we can have either elevated IOP, but there are no defects in optic disc changes, okay, or we can have visual field defects, but no raised in IOP and no disc changes, or we can have just optic disc changes but no defects and no raised in IOP. So any of these one condition is there, it is called a glaucoma suspect. Okay, so along with that there should be, they can have someone has a family history of glaucoma in the family, they are also considered as a glaucoma suspect. So the person who has a family history of open angle glaucoma has 8 times more risk of developing glaucoma, right? Is coming to the risk factors. So there are a number of factors which have been identified, such as thin corneas, less than 535 microns, increase in the intraocular pressure, increase in age, and cup disc ratio of more than 0.6. Okay, so all these are the known risk factors. Some other risk factors include the general systemic factors as well as ocular factors. So the systemic factors include cerebrovascular disease, hypertension, hypotensions, hemodynamic crisis, atherosclerosis, coronary artery disease, and all are systemic. There is ocular and also endocrine disorders like thyroid and diabetes mellitus, like that. So coming to the ocular factors, there is diurnal increase in diurnal variation in the IOP. There is large cup disc, as we already said, and they can be peripapillary atrophy and optic disc hemorrhage, and also myopias. Myopics are at highest risk, we know. So these are all the risk factors for developing ocular hypertension. So it is actually a diagnosis of exclusion, so we need to rule out any other causes like trauma, steroid use, etc. So coming to the investigation part, These are all the investigations which are employed in pre-perimetric glaucoma evaluation. So these are all the ones. So the normal one is white on white perimetry which is done. So whereas the pre-perimetric glaucoma, it employs other techniques. So it uses techniques such as blue yellow perimetry or frequency doubling perimetry. So these identify the earliest field defects, and we can also use short wavelength automated perimetry. Other than perimetry, we have confocal scanning laser, ophthalmoscopy, ocular coherence tomography, nerve fiber layer photographs, and we also have scanning laser polarimetry. So all these are the investigation which can be done. So the other ones include motion detection perimetry and pattern electroretinogram ERG. So these are the investigations required in case of identification of a pre-perimetric glaucoma or a glaucoma suspect and all. Okay, so these are all very important. At least we need to remember the names of these things. Now coming to the treatment part. So we need to aim for at least reduction of IOP by 20%. So in normotensional glaucoma we had 30%, here we have a 20%, and we need to be following up these cases. So we have a risk criteria over here. So who are at high risk, moderate risk and low risk. So high risk require treatment and we should reduce the IOP by 20%. Moderate risk, just annual follow-up is required, and for low risk the follow-up is every 2 years. So who are the ones who need high treatment? So the ones whose central corneal thickness is less than 555 microns, or the IOP is above 30 mm of Hg, or there is increased cup-disc ratio more than 0.4:1. So these are at the high risk. Who are at moderate risk? So the moderate risk are the ones who are in the middle of this. So here the CCT is between 555 to 588 microns, and the IOP is less and cup-disc ratio is normal, and the ones who have family history and myopes come under moderate risk. And the low risk are the ones whose central corneal thickness is less than 588 microns, Okay, so they require every 2-year follow-up. Yes. So, what are the drugs which are employed in this patient? So, and there are some indications who need early treatment. So, those who are young, myopes, and the one who is one-eyed. In such cases, we can also start early treatment so that the patient does not fall back. Fine. So, how do we initiate the treatment? So, we usually started with the help of a monotherapy. Start with one eye. If there is optimal response, we can see, then go to the second eye also. So what are the common drugs we can use? We can use prostaglandin analog. So these are most commonly indicated. Can be given alternate days schedule. And we have beta blockers, brimonidine, and adrenergic antagonists, and all. And cataract surgery also significantly reduces the IOP. So if the patient has cataract, we can try removing the cataract first before giving this treatment to them. So yes, according to this, there has been a ocular hypertension treatment study which was done. Ocular hypertension treatment study. It was done to evaluate the safety and efficacy of this topical ocular hypertensive medication and its effect on the patients with ocular hypertension. So, the effect of topical anti-glaucoma medication on ocular hypertension. So what did they do so they found out that the central corneal thickness was the most important predictor for the development of open angle glaucoma, and the ones who had older age and the ones with more vertical or horizontal cup disc ratios and higher baseline IOPs were at more risk of developing this glaucoma, and the ones who had history in family also had this. So based on this, they actually created this fibre group, created a risk calculator. So it is named by star 2 risk calculator. So it takes into account some factors which we already discussed, like age, the intraocular pressure, central corneal thickness, pattern, standard deviation on perimetry, and cup disc ratio to decide whether there is high risk or low risk of development of actual glaucoma. So these were all the factors which were identified in ocular hypertension treatment study. Right? So yes, this was regarding ocular hypertension, its treatment, the treatment study, the risk factors and all. I request you all to subscribe to my channel to get updates regarding all the important questions in ophthalmology. Thank you for watching.